There are a number of risk factors that increase your chance of getting throat or mouth cancer. One of those, cigarette smoking. We start this segment with a former smoker named Terry, who shares her personal story.
There are a number of risk factors that can put you at a higher risk for getting oral cancer. One of those is smoking, and we have a former smoker named Terry who shares her story of oral cancer.
I had my first cigarette at age 13, and at age 17 is when I really started smoking on a regular basis. And then in 2000 is when I found the little sore on the inside of my mouth, and it wouldn't go away. And on a routine dentist appointment, he saw it and he thought it looked suspicious, so he did a biopsy. Well, it came back as mouth cancer. So I had to go through radiation. And then in December is when we discovered the tumor in my larynx. The day of my surgery, I can remember smoking up to the front door of the hospital. That's how addicted I was. And I didn't know that I was so addicted until after I got out of the hospital. When I went home, I went straight. I went straight to my bedroom, picked up a cigarette, put it in my mouth, and lit it. And for the first time, I really looked at myself in a mirror. And I thought, Terry, what are you doing? You have a hole in your neck, and you're getting ready to use what did it to you. My advice to somebody who doesn't smoke, don't ever start. My advice to those who do smoke, please quit, or at least try.
So apparently Terry found a sore in her mouth. We have an image to show you this, a 3D image to kind of show you what was going on here. We're going to get to that in just a moment, but first we're going to, there's a lot to handle there, and listen to her. You feel badly for her situation, but we're going to hopefully learn a lot from it in just a moment. But right now we do have a caller on the line. So Robert from Miami, are you there?
Yes, I am.
Hey, Robert, what's your question?
The two questions. Do you think there will ever be a test, oral liquid test, in other words, swallow or partially swallow something and then spit it up and check it for oral cancer? That's question number one. Number two, shouldn't the dentist at least every 6 months turn on the special light and look in your mouth for 30 seconds? Instead, I've been in 5 different groups. None of them have ever not only not used the scope, they've never even mentioned, I'm looking for oral cancer. And I went to the doctor about pain in my mouth, and he said, I don't see anything. It turned out to be the jaw pain, but he was not thorough enough to say, oh, maybe it's, in your jaw. So that's my main question. Shouldn't it be a regular check, even if it's only once a year? And shouldn't you use the scope? And will there ever be a test, oral test, a liquid you can partially swallow, and then it might show cancer cells? That's all my question.
Okay.
Okay, thanks.
Sure. So addressing the first question in terms of is there a liquid test for oral cavity cancers? There are some products that are in development, some that are out there that appear to illuminate the mucosa of the mouth. I would have to leave it to my dental colleagues somewhat in terms of how effective they feel that those are. For the most part, a lot of these cancers, if they're going to develop in the oral cavity, that they start as lesions that are basically areas in the mouth that are either sore or look somewhat different from the rest of the mouth. and so are often, so they are can be either identified or patients will come in with symptoms and then get evaluated at that point. In terms of, as you asked for, screening, and I think you're referring to when people put the camera through the nose to look down into the throat. And generally, on a routine basis, that's generally not done. However, for patients that do have symptoms, then we always will do a full exam in terms of looking in the mouth, evaluating if there are any lesions or any areas that are abnormal, and if the physician, dentist, other provider feels that doing a scope is necessary, then that can be done. I'm in a somewhat biased position because all the patients that I see have generally been diagnosed with a cancer. That said, most patients or most people who develop either a sore in the mouth or have a symptom, for the most part, the vast majority of cases, it's not related to a cancer. And so we like to tell people that for things that pop up and maybe cause some symptoms for a week or two, and then eventually start to get better and go away, those are not the types of symptoms that we get that worried about. What we do worry about are things that are persistent for a period of times, a couple weeks or longer, and also for things that are getting worse. And so at that point, we always recommend that people get checked out. And so I think that's what we will generally go over with patients.
If you want to watch the entire episode on oral cancer, just download the Health Channel app.